Smile in a box. Essential hints and tips.
Hi, my name is Justin Peltier. I am one of the surgical planners in the Montreal Smile in a Box office. Our mission at Smile in a Box is to provide you with the best treatment plan possible, as well as the tools to achieve it, such as your surgical guide and provisional restoration. None of this would be possible without having access to the proper data. So today, let's review together the most common question asked by our customers in regard with data submission.
What are the minimal data required by Smile in a Box for a dentate patient?
The minimal data needed to treat a dentate patient are a CT scan of the patient and a set of intraoral scans. The set of intraoral scans include the arch to be treated, the opposing arch, and a bite registration. The CT scan must be submitted as a zip DICOM format and the intraoral scan in STL or PLY format.
What are the minimal data required by Smile in a Box for an edentulous patient?
For a dentulous patient, a dual-scan protocol must be followed. This means a scan appliance such as a denture should be used during the data acquisition. Radiopaque markers are placed on the denture and a CT scan of the patient wearing the denture is done. Then a CT scan of the denture by itself is done. Both scans must be sent out to the Smile in a Box team. To have more information on this process, please refer to our much more detailed scanning protocol to know more about the dual scan acquisition.
What are the most common mistakes made by customers when they submit a CT scan?
Many of the CT scans we receive are showing artifacts such as movement artifacts. It is important to ask the patient not to move or swallow during the scan acquisition. We also receive scans with limited field of view. Sometimes even the region we're working on is outside the field of view. It is important to inspect the CT scan prior to sending it our way.
What are the most common mistakes made by customers when they submit an intraoral scan?
Some of the IO scans we receive show double surface or holes. If we receive incomplete or damaged data, we will have to request the patient to be rescanned. Please also provide us with a scan of the whole arch instead of a small region of the arch, even a single unit case. It helps to adequately align the model and the CT scan. We also receive CT scan and intraoral scans that cannot be aligned together because they were acquired at different time. It is very important to provide us with recent scan acquisition and to proceed with the acquisition at the same time.
What additional information should be provided to achieve the best surgical outcome?
The Smile in a Box team wants to know as much as possible about your patient overall treatment plan. Please share information about the whole restoration plan, including the opposing arch. For full arch cases, it is always helpful for our team to get pictures of your patient smiling. Pictures helps us to validate the position of the midline, to set the occlusion plane, and to select the proper shape and size of the teeth. We can of course design a wax-up without pictures, but the quality of the outcome will be improved if we get them. Thank you for listening, and remember that the quality of the data received by Smile in a Box will affect the quality of service and the surgical outcome. In other words, you get what you give.